here we go. And when's the last time that you were adjusted?
I don't even remember. It's been...
What did you put down on the sheet?
I would say maybe like once at the beginning of this year, possibly.
Oh, that's right.
Or maybe like late last year. I can't really remember.
So not so much neck pain, but it's sciatica on this right-hand side.
Yeah, it's getting to a point where it's just like I just feel pain like in my knees, my back. I mean, my shoulders, and just I'm just like achy.
All right.
Achy breaky all the time.
All right, we got a right atlas. We kind of knew it was there. I can never tell how somebody's going to be until I actually get my hands on you guys.
Right.
Start feeling what the skin and what the tissue feels like. You can tell a lot about a person. Your neck feels really loose, though. It feels... I mean, that's your atlas right there that's fixated, but I can tell that this isn't... I'm not going to have a problem with it.
Right. Well, that's good.
It's when you try to bend back the joint and then it doesn't do that. I know we're in trouble. But this is pretty good. I'm aggressive, so you just let me know. So he's not a novice at chiropractic. So he's been adjusted before. Just not by me.
No, and I don't get adjusted regularly. It's like once in a blue moon, so I should probably fix that.
You should need to probably make some changes.
Mm-hmm.
But, you don't know what you need until you've experienced it.
Right.
So, if this helps you, then you know. If you don't know anything, you don't know what you don't know. There we go. Okay, so that feels pretty good now. I try to wiggle the joints first so that my job is easier. You doing okay?
Yeah, I'm doing good.
Here we go. My knees. This has been a little bit since you've had something like this done.
I've actually never had something like this done.
Oh, really?
No.
Not like this.
Not like this at all. It's not bad. It's just different.
Okay. Other side. Give that a break. Okay. Hey, first time is always like, what are you doing to me? I remember those days. And then, it becomes old hat. And you're just like, la, 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 la. So you can always tell when there's a new patient and a returning patient. Because returning patients will just talk through it.
Yeah.
You guys are like, you try and then,
Trying to
not
fight
yell.
through it.
I will not scream. There we go. Relax your head.
No.
That's it. Here, Linnea. His problem is down at the base of the left side. Oh, let me if I stretch that way, get a little bit deeper layer. Oh, and it leads down into the shoulder. Look at that.
Oh, that's...
Sorry.
No, you're...
Yeah, wow.
Ah, wow, yeah. Oh, how unfortunate.
There we
For
go.
me. Yeah.
You will be sore tomorrow. There's no escaping it. Okay. All right,
Yeah.
Let's start over.
You're good.
Right hand side is still congested. So this is where the adjustment comes in.
Okay.
And then we do it over again. That's how you get it all moving.
Anytime I've been adjusted, there's been no massage.
Oh, well, that's unfortunate.
Yeah.
That's the unfortunate part.
Yeah.
Here we go. I gotta correct this right atlas here. Good. There's the rest of it. Other side. Let's park the other end of the car. Ooh, some of it just popped right there. Right here. Right here. Nope, that's all it's gonna go. If I feel end range, I feel end range. Like that's as far as it can go. So he broke his ankle when he was a teenager, right through the growth plate. Never had surgery on it. Nobody ever recommended he do anything about it. So he has an anatomically short right leg. But the ankle's giving you problems, and you don't exactly know which bone it was that was broken?
It was the tibia.
The tibia, okay. So here's the talus that rocks right underneath it. Was it in here?
No, it was more like...
On the outside? The tibia is a big bone.
Yeah.
So it could have
right,
been
kinda
here?
Like the top of the... Yeah, kind of like...
Because the growth plate would have been in here.
Probably.
I can't even pop it. Let's see what this one wants to do. That one goes no problem. All right, let's try this one. There's nothing wrong with joint mobilization.
Wow. Yeah.
Nothing wrong with some joint mobilization.
Yeah.
What? See the knees? He's also having knee problems, probably as a result of it. Where in your knee is it hurting? Inside? I think that's what you said before. I think there's some torque on it.
Yeah, that's my right knee. Yeah.
Does it hurt when I do that?
No.
Okay, so it shouldn't
That's
be
more like a feeling here.
in there. Okay, I'm just making sure that you're...
Yeah.
Okay, I'm going to check out a couple of the joints here. Any pain in here? This is the medial meniscus, right here. Okay.
Right.
Here's the lateral meniscus, medial meniscus.
I feel more pain on
the medial side,
yeah.
Inside. Okay, so for this one I have to adjust it when you're on your stomach.
Okay.
Okay. Which is the little bone on the outside. Yeah. In fact, there's more fixation on that side.
This hip constantly like pops when I'm like...
Reach overhead and grab the table. Let's see what it wants to do. Yeah, you gotta... Feels okay. Feels healthy. This one has more mobility though, you're right.
Yeah.
So the way we do this one... Like that. Good. Pretty good. Always do the other side. Okay, they both feel okay. All right, there's nothing. I don't feel degeneration in your knee. Okay,
that's good.
Yes. I don't really even feel it much in your ankle.
Oh, really?
No. Moving on. I'm gonna move on. I have a new roller. This one is only $60.
Oh, wow.
The green one is $130.
Oh, wow.
No, this one isn't as long. It's made by a totally different company, but I don't know. We'll try it out. You tell me, okay?
Yeah, I'm good.
Right here we have some congestion. Just keep breathing. Oh, well, there was some of it. Just a lot of congestion right here. Oh man, now that's why your low back hurts.
Yeah.
That's so this is how it works, okay? When this bottom T12, this is the lower part of your thoracic spine, so about T8, well maybe not quite as high as T8, but when these areas get stuck, guess what takes up the slack? Lower back. And the lower back aches.
I definitely have those.
You're like, yeah, whatever that is. Alright, I think I've got it loosened up enough to adjust it. So you ready for that part? All right, deep breath in. Perfect. Good. And again. Again. Wow. How much does your back crack?
A lot.
It keeps going and
Yeah.
going and going. And again. And this one's not going to pop, I don't think. I just got to check it. There's always one on the opposite side here. There's that one. Perfect.
Oh. Wow.
I think we got them all. And we start over. You thought it was over.
Oh.
Kind of like this little blue one. Ooh. There's another one. Again. One more. Perfect. Okay. I'm trying to catch it before it cramps again. Breathe. Second one down. Breathe. That's it. There you go. Come on back. I'm having this battle with your back.
My body's trying to fight you to like resist because it's like I don't like the feeling of this.
Nope. You will yield. Go. Okay. Now that we got that taken care of, now we can move on. Okay. Moving on. Now you're not going to like me after this. Here we go. I'm starting on the good side, okay?
Yeah.
So you have some idea. Here's the SI joint. Hamstrings. Why we can't touch the floor. Good. Now to the bad side. This is the side I'm going to have to pick apart. So I'll try to start off nice, but that never ends up that way.
You gotta do what you gotta do.
If this is probably, I feel a pocket right here. Is that about where you feel the pain?
Yeah.
Right here? It's a little bit above the sciatic nerve.
Oh, there it is.
No, a little over to the left, a little over to the right. Yeah, right there. So we're doing a piriformis release. So what were you saying earlier? Okay, so I was saying this is the part that I usually just cut out because nobody has the patience. You know, I'm just kind of sitting here applying pressure.
Yeah.
So these are the parts that I usually just leave out because they're kind of boring. I'm not doing anything.
It doesn't feel boring.
But it doesn't feel boring to the patient.
No.
It just feels like pain.
Like a mixture of good and bad.
Yeah, it shouldn't be that way, but unfortunately it's just the first step that you gotta go through. Okay, back down to the glutes. So what I was saying earlier is that the piriformis muscle, which is this muscle right here, it frequently entraps the sciatic nerve. The sciatic nerve is kind of a weird design. It either goes straight through the piriformis, underneath the piriformis, over the piriformis. It could go all different ways. It's kind of woven into the muscles underneath the glutes. And if we can get the piriformis to relax, you can generally decrease the sciatica. But in order to get there, you kind of fire the sciatica at the same time. So you have to be very, very careful. In general, I just say keep moving over it and don't hold a pressure point here.
Right.
Just keep gliding over it. because that nerve is not very deep.
Yeah.
You're like, I know, I feel it. You're right on it.
Well, typically, like when I'm at the gym before I work out and I stretch, I usually use foam roller and just,
Oh, you foam roll this area?
Yeah, I always try to. Yeah.
Okay. I can tell it's not horrible.
Yeah.
In fact, what I think we need to learn is how to foam roll the mid-back.
Yeah.
This is your problem. And you didn't know. You're not going to know.
Yeah.
The pain is here. It's not here. So you don't think that this could be actually causing this.
Right.
But it is. And as I push on it, you're kind of going, wait a second. Why is that so painful? If you get this moving, your sciatica will be less. Pretty much guaranteed. I can't guarantee anything because I just won't. But pretty much if you fix this, it doesn't matter that you have an anatomically short leg. It doesn't matter any of those things. What we were saying earlier is that the break in his tibia just enhanced, it made his leg permanently short, but everybody kind of has a short leg on that side. So I don't really see, this is so out there that we have to eliminate this first. This must be taken care of first. Come on. Okay, I don't care if it cracks easily. You are knotted up here. Okay.
Yeah.
All right. Moving on. I know. Ouch. Gripping the table. I'm sorry. Breathe. Oh man, huge piece of scar tissue right here.
My body's like, trying to
What?
get away. It's like, get away.
Oh, I'll make it go the other way. You thought you were crooked. You won't be afterwards. Yep. Turn that leg in. He was like, look at my feet. This one is way out. I'm like, not for long.
Yeah.
We'll fix it. There you go. There it goes. There it goes. One more. Come on, give me one more. There it is.
Oh my god.
Ah, you did scream.
Oh.
I'm just kidding. Jeez, I'm so mean. Okay, but do you see how, I don't know if you can tell how that pulls in the leg.
Oh yeah.
You're like, whatever.
Oh, I can feel it. Oh god.
I mean, what do you think could fix this? You think some gentle pops are going to fix something that's
Yeah.
anatomically been broken?
You would think, yeah. But
Yeah, that's what we sell.
it's not easy.
No. Even with all of this, can it fix a break? No.
That's not how the force works.
That's not. If only I could just use the force and
just.
command it. Right here, huge lot. Even down in the hamstrings. I'm sorry.
No, you're good.
You're like, I thought you were gonna say, no, you're not.
Well.
That's usually the response. Yeah. No, you're not.
I will say it's like, when I broke my leg or ankle years ago, like, there's nothing been ever painful since that, so.
That's probably one of the worst things you could go through.
Yeah, so.
Having a part of yourself broken like that.
Yeah.
That's enough to put you out. That pain. I remember they gave my niece's wrist broke.
Oh, wow.
She fell on an outstretched arm. And the picture that they send to me is my niece, but she's kind of laughing and her arm is all crooked, because it's broken.
Yeah.
And I'm like, why is she laying there like with a smile, like a sleepy smile? It's because they had given her morphine.
Oh, yeah.
She was
So that works.
like, that's not how a break feels.
Yeah,
her
exactly.
face didn't match.
Yeah.
It was because of all the morphine.
Yeah.
Oh, wow. Ooh, okay, we can't do roller on that. That is... Oh. Well, I think we figured out why you have pain. If you have pain down into your leg, sciatica, do you ever have shooting pain down your leg?
Depends on what I'm doing.
I mean, this feels like you live with sciatica down into here.
Yeah.
what happens is you can tell when people live with that because they'll have a series of pebbles down into their calves.
Yeah.
That are just, see right here, he's got 1, 2, 3, 4. You have a bunch of them. Let's just put it that way.
Yeah.
And I don't know how I'm going to do this without pulling on your hair here, but I'm going to try. Is it okay like that?
It's okay.
Yeah, he's just got a series of knots all down his sciatic nerve. This is not good. I'm sorry.
Yeah.
You might have some disc degeneration.
Mm.
I'm not sure yet. So this is the sciatic nerve, and he's just got one here, one there. You can see as I go, oh, there's one. That one's painful probably. There, one. And then, oh my God. Okay, breathe. This is almost as bad as the butt cheek. Yep. Okay. Wow. You can just tell comparatively between the two calves here that this side is just so much more, many more trigger points in here. Because it's been, what, almost 10 years like this? So to break this cycle down, ugh. Okay, there's one actually in the arch of the foot. Well, this is your good luck sock, so good luck. I'm just kidding. So we're going right in the arch of the foot here. Okay, right where that banana is. Right here. Ooh, toes are cracking, everything's moving. Right where the navicular bone is, there actually is the end of the sciatic nerve. See if we got any better here. Okay, so what we're gonna do is adjust your side posture, okay? I know, you're like, how can I move? I plastered you into the table. You just wait, we haven't even really finished. You're like, I'm leaving now. All right, bottom leg straight for me. Bottom leg is straight, that's it. Now arch yourself back. Perfect. Here we go. Breathe. Perfect. Other side.
Oh my God.
Come on this way. Can you, or are you like done?
I just don't want to move.
Isn't that what I always say afterwards? I'm always like, just leave me. Leave me. Leave me. Back, head back off the table. No, it's okay. Let the leg drop. That's all I got. All right. What are you feeling? Is it really that bad? Are you okay?
I'm feeling wonderful.
Are you being sarcastic, facetious? What is the right word?
You ever seen Empire Strikes Back?
I think so.
Remember when they're like torturing Han and they bring him in, and he's like, I feel terrible. And they have to like drag him in by his arms. I mean, I don't know about that, but I feel better. I just feel so much like release. Really
Exhausted a
little
little bit.
God,
Yeah.
I feel like I ran a marathon. It's weird.
Okay. All right. Just take some breaths.
Yeah.
We're gonna do a final ones up higher, okay? But you're gonna sit here on the ground, face that wall. Your back is gonna be towards me over here. Because this is your final. This is kind of your reward, but at the same time it's a torture device.
Okay.
Here we go. Because it's gonna train you how you're supposed to be. Bend your knees. Because you're slouched forward. So the only way to get rid of that is to stretch and hold it at tension to create change. If you don't, I can keep forcing you to have correct posture, but it will never happen. So, but thank God it doesn't take much. This is like 5 minutes a day. This is the hardest it will ever be, I promise. Tomorrow, if you decide to do it, you're gonna be sore, but the next day, it'll be a piece of cake.
Yeah.
You have to train it somehow.
Just go to the store and buy regular foam roller.
You can. Those you can get on Amazon. They are Myo. Oh dear Lord. I usually just say I leave a link below. I'll give you a.
Yeah.
This is new. I've started doing this because I was using the foam roller, but it wasn't. I couldn't get in between the shoulder blades.
Yeah.
And that's where half of people's problems are. They would hit their shoulder blades and they're like,
yeah, I hate that. Yeah.
and so this thing is skinny, but it's $35.
That's not, that's fine.
Well, I mean, compared to adjustments, it's cheap. But you'll and things will pop. You're very flexible. That's what you have on your side. Is that I know you think that you're not.
Yeah.
But as soon as I started popping and cracking you, I was like, no, you're inherently very flexible. Your spine has a lot of flexibility. Your neck just went crack. Your back went crack. I mean, every single one of them went, except for that hip, which I got to the bottom of it. There was just no pop.
Yeah.
So, oh well. This is, I'm going to exaggerate. I'm going to be you, okay?
Right.
This is how you should be, but you're this. You think
no.
you're straight. You think you're straight.
I feel it, yeah.
Okay?
No, you're not wrong.
There is no way you're going to get rid of that by forcing yourself. You have to stretch. It's not hard.
Right.
Okay? You're still what? How old are you? In your 20s. Okay, you have plenty of time here. It's when you get to like 35, like my age, and you have never done anything like this.
Right. Oh, wow.
It takes a much longer time. You're going to be better in no time. Every year that you wait, it becomes progressively harder. Okay, once you hit 30, things just dry out. And my mom would say to me, "Wait till you hit 60." You know, but my point being is start now and you'll be okay. Gotcha. You have the best thing that you have is flexibility. That's going to save you from degenerating. I don't feel hardly any degeneration in your joints, even the ones that you broke. Listen, I felt degeneration. It clicks, it grinds, it feels awful. It was out of place. If anything, you heard it clunk. Mm-hmm. It was rocked forward. So your talus, which is this bone right here, was rocked forward like that, and it was sticking out right here.
Yeah.
I don't know if you remember that. It was like this. It was like it was sticking out your talus like that, and there was a big lump here. Yeah. And I was like, whoa, it was a huge lump. And I was trying to flex your foot back and rock it back. I was like, you know. We finally got it, but oh my God, it went. I'm like, oh, that's gotta feel good.
Yeah, it felt amazing.
Meaning that you're sleeping with your toes pointed, like maybe in the sheets, you know, like with your feet like this.
Yeah, I do.
And you don't realize it.
I do, yeah.
Yeah, I'm wondering now how much of this is from a displaced talus.
Yeah.
Than it is really a break in the growth plate.
Right.
Because it just, when it clunked, I went, that's gotta feel better.
No,
but we won't know yet until you walk around.
I never felt that.
Nobody's ever done that one to you?
I've never felt that, like that pot you're talking about. I've never felt that, like, in there, like, I don't know.
Well, we're sticking out. I'm going, ooh. Yeah, like,
never felt
nobody fixed this, you know, because it's not a hard one. It's like a rocking chair. It goes back and forth and back and forth.
I haven't felt that. Well, I'm trying to think, because right after, I was stupid, I shouldn't have done it, but like, right when I got out of the cast and I had the boot, that stupid space boot they make you wear, I, like, my calf was not nearly as strong as my left, and I went right back into playing basketball. I was in high school.
Did you roll your ankle?
I don't know if I rolled it, but like, I remember I pivot, or I was like,
You stopped and turned.
yeah, I stopped, and then it just like cracked. I thought I broke it again. I was like, oh no, please no. But yeah, it was weird. And then like.
Okay, yeah, this
So,
feels something
it
more
was,
like
it was not
that.
strong enough, but.
Because it's not a break. Do you know what I mean? This is
Yeah.
a displacement.
Yeah.
Like the
that's what
joints weren't setting correctly.
Yeah, that's what it feels like over the past 10 years. So. Yeah.
So it's about 5 minutes, and I'm going to teach you how to get off of it.
Okay.
Because you're like, no,
I'm stuck.
I'm stuck.
Yeah.
No, you can get off of it. You're going to roll. People forget. They try to do a sit-up.
Forward?
No. You can.
I
But I want you to
that
roll
way.
sideways.
So just like roll off to the side.
Yes.
Okay.
If you can. If you can't, then just roll higher on it.
Okay. Just like go this way or.
No, you're going to go down. It's
Down.
easier the higher you get. So keep going that way. It's going to hurt rolling on it.
Great.
You're not stuck. I promise you.
Yeah.
You're not. You've got two options. You either go that way, and it's good for you. I know it hurts
Oh
like
my
hell.
God.
You're okay. I promise. This isn't. No, don't do that. Yes, roll.
There.
So I'm gonna just push you off.
Yeah, just push me.
That's so mean.
All right, we did it. All right, cool.
Bye, everyone.
Like, subscribe. Yeah. Visit the dragon. It's no joke. Oh my god.
Okay.
Oh. I feel like what you do makes much more logical sense versus just having someone just sit down, twist their neck, push them in back. All right, you're good to go. You know what I mean? Like, it would feel good, don't get me wrong, but then but I would still like deep the problem, the layer, like deep in the layer was still there, but you got to that layer.
Oh.
Holy crap.
That's my job.
I mean,
well.
you found the layer and you just went past the layer. I was like, holy crap. Feels so bad, but it feels so good, like, afterwards.
When I stop.
Yeah.